I'm Scott Singh. I'm one of the orthopedic surgeons here at UW Health, specializing in hip and knee replacement. Today we'll talk about hip replacement. So hip replacement is typically done for patients who have bad bone-on-bone arthritis with sharp pain, a deep ache, typically in the groin or the lateral aspect of the hip. Now, there's multiple ways to do a hip replacement, multiple approaches. All the approaches are good approaches. There's posterior approach, there's anterior approach, there's lateral approach. I'll be focusing on the anterior approach and the advantages of an anterior approach. Anterior approach is typically done through an incision in the front of the hip that's about 3 to 4 inches in length. We are able to do the surgery without taking down any muscle, which helps us with recovery, less pain post-operatively, and quicker discharge. Usually we're able to also position the patient supine, laying flat on the bed on a specialized table called a Hana table. That is advantageous because we can get a reliable x-ray like this we see here. We usually template these hips before surgery, and we can use the template and get an x-ray to have perfect placement of the surgical components, which are like this. So what we actually do in surgery is we take out the head ball from the hip joint that is arthritic, cut out all the bad arthritis, and we replace it with personalized components that are fit to your anatomy. That goes into the hip just like this. It's impacted in there. This is typically a ceramic head ball that is going to fit into this portion, which is the socket, which also has a component that is metal. This metal component goes in here. Over time, this will become a part of your body. After the surgery, you're able to walk on the same day and get up with therapy. There's no dislocation precautions because we test the hip intraoperatively as you're laying down flat to make sure it doesn't pop out of the socket. Because we can get x-ray in surgery, we can make sure that there's no surprises in the post-operative follow-up on the x-rays because we position the components perfectly, and that allows us to have more reliable outcomes. Why don't you schedule an appointment with us if you're considering a hip replacement, and we can decide if an anterior hip replacement is good for you.